In this video, we're going to look at how Physiopedia's AI assistant, PAI, can help us check for red flags. Let's open up PAI in our Plus account and first give it the case that we are concerned with. I'm going to just turn on dictation here so that I don't even have to type it in. You can do this on your computer or your phone as well. Just look for the button with the microphone on it. My patient is a male 45-year-old office worker presenting with chronic low back pain ongoing for 8 months. He reports a constant dull ache in the lower lumbar region rated at 4 out of 10 pain, with occasional sharp increases to 7 out of 10 during movement. Pain is worse after sitting for long periods and in the mornings. There is some pain radiation to the right buttock, but not beyond it. He has tried over-the-counter pain medication with minimal relief, and he is previously active with regular gym attendance, but has reduced activity due to pain concerns. Just by giving it the case, PAI is already going to come up with some ideas on what is going on. We're going to go straight to the red flag check under tasks and see if PAI can identify some potential red flags. So in this case, PAI doesn't think there are any immediate red flags, but it does note some areas of concern. And then it provides some recommendations in terms of the assessment, as well as some opportunities for improvement, which tells us what other information we could give PAI to help improve its answer. Let's say we give it some more information. The patient denies any systemic symptoms, changes in bowel or bladder function, any history of cancer, or neurological symptoms. The patient has gotten an X-ray, but no abnormalities were noted. What other questions should I ask to rule out red flags in this case? PAI then gives us some questions that we could ask our patient. And of course, we can continue the conversation. For example, I could ask, which are the most important questions to ask? PAI is able to narrow down the list of questions and also gives its rationale for why it chose those questions.